Hello, everyone. Today, I would like to cover scanning techniques and key diagnostic tips for superior parathyroid lesions, which are often easily missed in clinical ultrasound. To accurately identify parathyroid lesions, it is crucial to thoroughly understand the embryological location of the parathyroid glands, neck anatomy, and their structural relationship with adjacent muscles and cartilages. Let's take a look step by step. Compared to the inferior parathyroid gland, the superior parathyroid gland has a relatively constant anatomical position. It is typically located posterior to the thyroid cartilage and cricoid cartilage, near the inferior constrictor muscle. On a transverse ultrasound scan, the cricoid cartilage, cricothyroid muscle, thyroid cartilage, and inferior constrictor muscle can be identified, with the superior pole of the thyroid gland situated laterally. The superior parathyroid gland is located lateral to the inferior constrictor muscle and posterior to the thyroid gland. Without prior knowledge of this anatomical relationship, it is easy to miss these lesions. Here is the first case. This patient presented with hyperparathyroidism. Due to underlying diffuse thyroid disease, the thyroid parenchyma was hypoechoic and heterogeneous, making the diagnosis somewhat challenging. The superior parathyroid lesion is located right here. On the transverse view, it is identified lateral to the inferior constrictor muscle and posterior to the thyroid gland. On the longitudinal view, a portion of the thyroid cartilage is visible with the parathyroid lesion located below it. Care should be taken as this lesion can easily be mistaken for the inferior constrictor muscle. Looking closely, you can observe echogenic normal parathyroid tissue surrounding the lesion. Let me show you the video clip. On the normal right side without a parathyroid lesion, the thyroid gland is seen directly lateral to the inferior constrictor muscle. On the left side, unlike the right, a parathyroid lesion is visible next to the inferior constrictor muscle. You can also identify the echogenic normal parathyroid tissue surrounding it. This is the next patient, who also presented with hyperparathyroidism. In this case, the superior parathyroid lesion is located slightly lower than in the previous case. On the transverse view, it is similarly positioned lateral to the inferior constrictor muscle and posterior to the thyroid gland. On the longitudinal view, as a more lateral plane is captured, the lesion is observed where the inferior constrictor muscle is clearly delineated. This is the final case. This patient also has hyperparathyroidism, with the superior parathyroid lesion located even lower than in the second case. Due to its location, the inferior constrictor muscle is not visible on the transverse view. However, on the longitudinal view, the thyroid cartilage and the surrounding inferior constrictor muscle are clearly visible, with its internal muscle fibers, demonstrating a pinnate or feather-like pattern. The parathyroid lesion can be confirmed just below it. In conclusion, carefully examining the normal anatomical structures of the neck and the spaces between them is key to not missing hidden superior parathyroid lesions. Thank you for your attention.